our vaccination program is kind of caught where everybody else is. I always say there's three phases of this. Not enough vaccine is phase one, not enough capacity is phase two, not enough people is phase three. And your question gets to all of them. So we stood up what was at the time the biggest vaccination site in the world at Dodger Stadium that can do about 20,000 vaccinations a day. We went to equity immediately with mobile teams, some that give vaccinations inside people's homes, others that set up in our lowest income areas, and that are doing over 95% people of color, calling people with a phone bank, texting people about appointments in certain zip codes that have been most impacted. Dr. Fauci highlighted these last week as one of the best in the country. He said, I got to tell the president about this, what you're doing in LA. So we're proud about that equity piece, but we don't have enough vaccines still. I could double the capacity today if you got me those vaccines. And I've been very outspoken with a group of 30 mayors, authored a letter to the incoming Biden administration, continued talking to my friends there about saying, give vaccines directly to cities. LA City is bigger than 23 states. LA County is bigger than 45 states. But yet we still have to go through 3 layers of bureaucracy before we get our vaccines. That seems kind of silly at this time. We'll soon go into the second phase where mathematically we're going to have so many vaccines that people aren't going to have the capacity to distribute it. I think in LA, we'll get around that because we built over 500 places that you can get vaccinated between community health clinics, the mega sites, the mobile clinics, our pharmacies, federal and state sites. It's the most in the country. And it's about 5 times the rate per capita of other big cities in America. So we're ready for when the vaccines come. We've got clinicians, we've got the method to do it. But the third one, which gets to the vaccine hesitancy, you're going to find a place when you have enough vaccines and enough capacity where you're not going to have enough people willing to. We're actually seeing some remarkably good things, Howard, where vaccine hesitancy is rapidly falling, especially in communities of color. And we've had a very determined campaign on this.